We do want to say thank you to all the nurses, hospital staff who are helping take care of those who have the coronavirus. And now we are into 669,000 worldwide. With rising cases comes fear, but knowledge in terms of what we can do is certainly key to feeling better about the crisis, at least a little. We've been asking you to share your questions and concerns on social media. Joining me now, Dr. Jen Caudle. She's here to answer some of the questions. Dr. Jen, as you see the numbers increasing and knowing what you know as a doctor, what are your thoughts in general on this? I mean, it's just unbelievable.
It is unbelievable, honestly, and I've often said this. If you asked me if we would ever see a situation like this in our lifetimes, I would have said, no, I don't think so. It is unbelievable, and it's scary, and there's a lot of uncertainty. But the good thing is we know things that we can do to try to flatten this curve and slow down the cases of coronavirus.
We're looking at a tweet that you shared about staying home and how important that is and why. Because some people may think, I'm fine, I don't really need to stay home. But what they may not realize, Dr. Jen, is they're not only helping themselves, but other people because of how fast it does spread, right?
Right, exactly. No, you're totally right about that. And staying home is one of the best things we can do.
So how long, this is a viewer question, and I've heard this kind of tossed around. I don't know if we know the answer yet. How long does the virus live on an object, something like a newspaper? Because this viewer says, look, my daughter doesn't want me buying the newspaper anymore.
Yeah, that's a great question. A lot of people have this question. I think it's, first of all, really important for us to go back to basics and remember how coronavirus is primarily spread. That's through person-to-person contact, through respiratory droplets, first of all. Now, there was recently a study that was published in the last couple of weeks that looked at how long coronavirus can live on certain substances. We found that it can last on copper for about 4 hours, and plastic and steel for about 2 to 3 days. And then we have cardboard for about 24 hours. So those harder substances, it tended to last longer on, and more porous substances, it doesn't last as long on. So do we have definitive data on paper? I'm not sure that we do, but I would suspect that it's probably fine to get your mail and to get the newspaper in particular. That's what we're asking about. Remember, coronavirus is not a very robust virus. It's not going to last through lots of changes in hands and changes in temperature and things like that. I think the best thing to do is after you get your newspaper, you need to wash your hands. The biggest thing is washing our hands and making sure that we're not touching our face. That's probably the best thing we need to do here.
I'm sure you have a lot of people, whether it be patients or friends of yours, calling, asking what to do. Is it just sit it out and wait as long as we are told to where it is safe to go out again? Actually, yes. Certainly for those of us who are healthy, and for those of us who are sort of sheltering in place, we need to be maintaining social distancing. That's what we have to do, staying 6 feet away from others, not going outside and being in crowded places, though it's okay to be outside as long as you are away from others. That social distancing, honestly, is one of the best things we can do. Obviously, if you have symptoms, you need to seek medical care, but also washing our hands, avoiding touching our face, and things of that nature. This is certainly unprecedented, as we both know. Should there have been a plan in place? It feels like there should have been. Joe Biden, even Bill Gates saying, look, the only way this is going to work is if we all decide to do it together and stay home, and they have to move faster.
Absolutely. And in fact, I as a physician, I would have liked to see sort of a more of a plan and sort of an anticipation of this a long time ago, to be honest with you. We've been talking about coronavirus for a few months, and the CDC has been anticipating that it was going to come to the United States. It wasn't a matter of if, it was just a matter of when. So we knew that months ago. It would have been nice if we really started planning sort of in a very serious way at that time. But what we can do right now, yes, is this social distancing. And we do all have to do this together. No one can be exempt from this. We all have to play a role and work together to stop this.
Yeah, also manage how you're feeling on the inside as well. Dr.
True.
Jen Caudle, thank you.
Thank you.